Hi, this is Becky of the More Than Borderline blog, and this is part 2 in my schema therapy lecture. As you may remember from the last lecture, schema therapy addresses the schemas, or the ways of viewing self-concept of people with BPD. Now, schema domains, as I mentioned in the last lecture, are disconnection and rejection, impaired autonomy and performance, impaired limits, other directedness, or an unhealthy focus on others at sense of one's own needs, and overvigilance and inhibition. Today I'm talking about schema modes. Schema modes are kind of complicated to explain, and that's not just me saying that. That's from the Schema Therapy website, or schematherapy.com. They use the definition, those schemas, coping responses, or healthy behaviors that are currently active for an individual. In other words, it's a mode of operation. A schema mode is activated by a trigger, or an event which we are extremely sensitive to. A case in point might be somebody doesn't respond when you say hello. If you have a schema of rejection, that may trigger an event where you feel rejected. Now, these schema modes override a person's functioning. Instead of being able to handle life, rigid coping skills and strong emotions prevail. It's something as simple as I said earlier. Not saying hi can drive somebody to feel so rejected and make them feel like the world is alone and cause them to want to self-harm. That's an extreme case of borderline personality disorder, though. Now, there are 10 schema modes. The child modes, the maladaptive coping modes, the maladaptive parent modes, and the healthy adult. In the child modes, there's the abandoned child who feels like no one is there, feels that they're totally alone in the world. The angry child who is enraged at their vulnerability and enraged that their needs are not being met. The impulsive child who cannot delay gratification, is impatient when needs are unmet, and acts in selfish ways to meet non-core needs and desires. In other words, stuff that's not even that important. And then there's the happy child, which is self-explanatory. This is what we mean when we say normal childhood. I run into the abandoned child and angry child a lot when I'm in the inpatient setting. That's just my observation. Second of all, there are maladaptive coping modes. There's the compliant surrender, which is where the personality becomes passive, even submitting to abuse, and often has a self-defeating conduct pattern. There is the detached protector, which people tell me I tend to hang out in. And this person will withdraw as a way to defend against pain. This may cause the person to appear cynical or aloof. The third of the maladaptive coping modes is the overcompensator, who becomes grandiose in an attempt to feel adequate. There are 2 maladaptive parent modes, the extremely punishing punitive parent and the extremely idealistic demanding parent who insists on perfection. Sometimes my job becomes hard for me to do when I am operating in a demanding parent mode because I'm so afraid of messing up that I don't get the work done at all. And obviously that's not going to be something that can work in the real world. The last schema mode is the healthy adult. This is what we mean when we say, I want to be normal. The healthy adult knows how to address the other modes, to set limits for the impulsive child, to banish the punitive parent. The healthy adult is what we need to aim for. And schema therapy really helped me to reach that. Now, I still have moments where I slip up and fall into one of the old modes, but at least now I have a point of reference I can find my way back to. And I wish you luck and wish you well in finding that point of reference. Have a good day.